Okay, so hi, welcome. I know you're so not technologically advanced. You just joined Instagram for this. I so appreciate that because I can't wait to have your wealth of knowledge for all of the people out there that are going to be listening because, when we spoke this week, it was just such a great reconnection. So let me just tell everybody about you and how awesome you are and how much I appreciate your knowledge and what you've done for the profession of health and wellness. So everyone, this is my dear friend Candida Iodice, right? Is that how you say it? Iodice.
Yeah.
Italiano. I don't speak it. But I love it. Bianca Antonella Francesca Valdini. You can't get much more Italian than that, right? Okay, so Candida has been an occupational therapist for 38 years, right? Am I right? Is it longer than that now?
For about 35.
3 years. It's okay because you got to add schooling in there, right? 35 years. It doesn't matter. Anything past 20 is not. So you started out as a hand therapist. Is that correct?
I started off, yes, right. As soon as I graduated, I actually started to do hand therapy because it was something that I was really interested in.
Okay.
So I've been doing hand therapy also for 35 years.
35 years. Okay. So you've been working at Mount Sinai Hospital in New York City for 30 years, correct?
That's correct.
Okay. And I want to ask you, when did you get into the osteopathy and how did that whole thing start for you? But let's start with the question, because I know some people on here don't really know what osteopathy is. So if you can give everyone kind of a background and understanding of what exactly is osteopathy and who does it benefit, and what are your types of patients outside of COVID, because we're going to get to that later.
Yes, absolutely. So osteopathy is this amazing science and art of using extensive knowledge in anatomy, physiology, biology, and then using our, very perceptive hands, because all of the work that you do is really through your hands, through feeling and seeing what the body needs to be able to reach better alignment, to improve with any kind of restrictions, so that function and healing can take place. It was actually it was developed and put together by this wonderful man. He was a physician actually in the 1860s. Actually, osteopathy was sort of created in 1874. And he was a physician during the Civil War and had personal reasons where he felt that medicine at the time was not really supporting people's well-being and health. And he became very disenchanted when in his own family, several children died of spinal meningitis, and his wife died during childbirth. So he had a lot of losses and felt that, the medicine that he was practicing was not good enough. And so for 10 years, he stopped practicing medicine and he started to study. He studied biology, he studied anatomy and physiology. And he was a very spiritual man also. And he felt that this amazing machine, that this body that we have, is so perfect in every way. And so therefore, within it must lie the secrets of healing and health. And so through that drive and through his own personal loss, he put together this group of approaches, and it's all manual therapy. And he felt that, he based his treatment approaches on some fundamental principles, one of which is that, the structure and the function are inextricably connected or linked, so that if you have a particular structure, then you can understand what that function is. And if that structure is strained, it's malaligned, it's injured, then the function will be affected. He also believed that within the body itself lies the potential, the resources for the body to heal itself and to maintain health. And we just have to figure out a way to bring those resources out, or to help the body to use those resources. And then finally and this was the visionary part also, that that a person needed to be treated holistically, that it's not just the body, but it's the mind, it's the emotions, and it's the soul that need to be treated together in order to be able to reach a level of health after disease. So his idea was that, disease sets in when things are out of alignment, when there is a reduction in the free flow of material in the body, in problems. So the techniques that he developed are all about using the body's structure to realign things and to improve circulation, lymphatic drainage, and to get things to work better together, because then what that does is it allows the body to heal itself.
Sure.
So that was the theory behind it, and that's what osteopathy is. And it's been the first school was opened in 1892 by Dr. Still. And
was this in America, or was this in
yes,
Europe?
He's an American. He was an American, and actually he was born in Virginia, then spent a lot of time in Kansas, and then in Kansas actually he had started to share some of these studies that he had done and all of these techniques, and he was pretty much ostracized by the medical community and by a lot of people who at that time felt this was way out there. It made no sense. And so what he did is he moved to Missouri, and there he opened a practice, and the practice was so amazing. People were getting better. He was treating everything from infections to headaches, to injuries, like, dislocations and things like that. And he was getting great results when, in the medical profession, people were not getting better. Many people were dying because there was just not enough at that time to really take care of people. And so in Missouri, he became very well known, and then he opened a school in 1892. What was really interesting is that he came sort of in a full circle. After doing all of the studies, he was able to save the lives of one of his neighbor's kids who developed spinal meningitis. And it was almost a way for him to sort of, connect to what had happened with his kids, and now to be able to help other people's children with the treatments that he had developed. So I think that for him was such a closure, to the loss of his children. So, and so when I learned about this, and I have my own, personal experience with osteopathy, when my experience with it was during, in '94, I had, we had wanted to start to have children. And I already had a daughter, and we had wanted to have more children, a second child. And the first pregnancy went really well. There was no problem. And then when we tried again, I ended up having 3 consecutive miscarriages. And after so many, different exams and tests and, processes that they had done, they really couldn't figure out what was wrong. So at that time, a friend of mine, who is my guardian angel, I call her, because she is, she's a mentor, and she's, she helped me out so much with osteopathy. She was studying osteopathy up in Canada. She's a physical therapist. Her name is Sylvie Herb. And she said, I am just studying about, the reproductive system in osteopathy school. Let me try this technique on you, and let's see what happens. And after one treatment, I got pregnant, and the pregnancy went through without any glitches, any problem. It was the easiest pregnancy ever. And, I was just sold on the idea. So I actually started to study osteopathy as soon as I could, like right after I gave birth to my second daughter and then my third daughter. Right. And I started to take classes, and I took classes with some osteopaths that came here to New York to teach classes. I took classes with Upledger, with Baral, and then in 2016, I found a school up in Ontario that was teaching classes here in Boston, actually, in Massachusetts. So I signed up for the program, and I got my 3-year. I finished the 3-year program and graduated in.
Yeah. You know, it's interesting. You know, when I think osteopathy, when I went to physical therapy school, I mean, you didn't know this until I told you the other day, but I actually graduated physical therapy school in the Netherlands. And our entire program in Holland was based on physical therapy from an osteopathic viewpoint. So everything we learned as PTs in Europe was hands-on. It was all hands-on manipulation,
Yes.
whether it was moving, you know, fascia, whether it was doing joint mobilizations. And it was just such a different technique. And when I came back to the States, I was like, well, you guys use a lot of ultrasound and e-stim, but what about your hands? You know,
Right.
it's like my hands tell me everything when I touch a patient. And then when I went to acupuncture school, it kind of solidified this whole idea of that mind, body, spirit that wasn't so westernized in, you know, physical therapy, medical kind of Western medicine. But, you know, how the emotions can affect your physical being, how, you know, things that just aren't necessarily like trauma can affect your emotional being, which could then affect your organ systems, you know, and you think about somebody that's, you know, my gut feeling, or, you know, pain in my stomach when, you know, they're having a sympathetic nervous system response to something, and it's, you know, fight or flight, and how that affects the physical nature, and how somebody with pain can have this chronic kind of emotional turmoil happen, and how it resides in the organ system or in the fascial system.
Absolutely.
So it's such a cool, you know, it's such a cool medicine, and how it integrates itself into Western culture. And unfortunately, there's not enough osteopaths, I think, out there. I even have conversations with surgeons and stuff, and I'm like, well, you're great at cutting tissue, but then, you know, you leave it to heal, and then what happens? You know, we say in physical therapy and occupational, you hold your issues in your tissues, right? So if you go into surgery and you're, you know, you're upset, you're emotional, you're in pain, you have this connection to your injury or to your trauma, and then all of a sudden it kind of shows itself up, and it could show itself up 40 years later, right? Absolutely. So, you know, for you too, you know, I do scar tissue mobilization work, and sometimes you'll have an emotional reaction to a scar that you had when you were 5, because it brings up all sorts of stuff. But I wanted to take this question on to, you know, the crux of today's talk really was about this kind of COVID situation, right? And oh, there's Jenny. She's on. Hi, Jenny. She's actually one of both of our patients, so we might have her come on in a minute. But Jenny, you came on at the right time, because I was just about to ask Candida this. You talked about COVID long haulers, and I wanted to ask you, what exactly is considered a long hauler? And you're treating these patients out of Mount Sinai, so you're working hand in hand with medical doctors and physicians on treating these post-COVID illness long haulers. And when I was looking it up tonight, I actually saw that 1/3 of COVID patients, 1/3, I mean, it was something crazy like 8 million, or I don't even know, the statistics were huge, but 1/3 of them have long haul symptoms. So can you tell me and tell everyone out there, you know, what's considered a long hauler, and what are the repercussions of this? What are you seeing?
Okay. So actually, long haulers are anybody who, after 3 weeks after being infected with COVID, continue to have symptoms. So that's why it's a large number. But, you know, most of those people will eventually, in a few weeks after that, will get better, will, you know, slowly get better. There is about 10% of that number who do not, who, you know, for whatever reason, they continue to have autonomic nervous system, you know, malfunctioning, meaning that, you know, they have, for example, fatigue. They'll have joint pain and muscle pain everywhere. They'll have digestive issues. They'll have headaches. brain fog. It also affects like memory, and ability to like focus.
Yeah, cognitive dysfunction as well. Yeah.
Yes, some of them have that too. They will have tachycardia. They will have just low energy. So these are the symptoms that pretty much, and shortness of breath. So these are the symptoms that seem to sort of linger, and with some of them, they don't get better. I mean, sometimes they'll get better, and then they'll do something, and then they just plummet again down, and they continue to suffer this way. So as you could imagine, not being able to get back to your normal level of activities, because most of these people, I mean, it's a very varied picture. I mean, some of them are very young, some of them are older, some of them had very mild symptoms, when they had the COVID.
Right.
And some of them were very, very ill. They were hospitalized. So it's just this very general picture. There's no specific thing that points out, or that predicts whether someone will be a long hauler or not.
Mm-hmm.
So what ended up happening with these people is that at Mount Sinai, we have, a post-COVID long hauler, clinic because there was all these patients, and nobody knew what to do with them. So some of the doctors got together, and they thought, it would be really good to do a more holistic approach. So they have different specialists in the group that will evaluate the patient. So the patient comes in, they'll talk about what their symptoms are. So depending on what is upsetting them or bothering them more. So if they're having cardiac issues, they'll see a cardiologist. They will follow up with, a neurologist if they're having a lot of neurological symptoms. There is a physiatrist that's on the team. And this is the person that is my contact person. Her name is Dana McCarthy. And she's the one that, I started talking to about, these symptoms, these lingering symptoms. And I kind of said to her, I think osteopathy can help because, I have treated people, with fibromyalgia, with people that have chronic fatigue syndrome, and some of these people who don't seem to really respond to a lot of different treatments respond to osteopathy. So I kind of introduced that because initially that wasn't part of the protocol.
So what were you doing on them? What kind of hands-on treatment would you be doing with them?
So after evaluating them, it seems to me that there's three major problems with their lymphatic system, their craniosacral system, and their fascial system. And so what I work on is, I evaluate each one, and depending on what's tight, what really sort of calls out to me, we start treatment there. So with some people, I'll start in the viscera because they have a lot of fascial tightness in the viscera.
So hold that thought. Tell
Yes.
people out there that don't speak our language, what's the viscera, and
Okay.
where, and what's, so talk to them as if they don't, I know what you're talking about. What about them? They might not know.
So some people, because they're having a lot of problems with their stomach, with their intestines, they're either not regular, or they feel very bloated. They feel like they're just uncomfortable. They can't digest things. So I start to work on, and especially if there's a lot of fascial tightness, I'll release the fascia in their stomach, around the intestines, the liver.
So let me tell everyone here what fascia is, by the way, because we were throwing this word around and you might not understand it. Fascia, I like to think of it as like saran wrap. And it's this kind of, it's a dense connective tissue, almost like a web, and it infiltrates all organs. It keeps organs in our trunk. It is, if you look at a bodybuilder and they have like those great muscles and they're defined, fascia is what defines the muscle. It holds everything. It's like an envelope. So It holds everything. It's the skin underneath our skin, and it sits on top of the muscles, and it holds our organs in place. So what Candida is saying, she's working on the fascial system. So when you have inflammatory processes, viral issues, bacterial problems, scar tissue, trauma, the viscera and the fascia will become bound, right? It becomes tight and constricted.
Yeah.
And like Candida said in the beginning of this talk, if things don't move, if there's not a free flow of circulation of lymph, of fluid, things are going to get stuck, and we don't want a stuck body, because a stuck body is a painful body. So continue.
And it's not only but it doesn't function well.
It
And
doesn't
that's why
function.
you get all the symptoms that sort of add up. I
Yeah.
mean, the fascial system is one of the most amazing systems in the body, I believe, and it's so pervasive. It's everywhere. You know, like you can go from one part of your body to another just without ever leaving the fascia. That's how amazing it is. So from the head to your toes, you can just go from one fascial system, one part of one fascia to the other, and you would be able to walk through the whole body.
So here's a great example. I'm going to just take my sweater, okay? Here's the arm of my sweater. Pretend that this is the fascial structure. If I tug here, you're going to actually see it move up here, right? So watch. I tug. And do you see how much movement is up here? So you can have a kink in the fascia here, and it will affect all the way up the chain.
Yes.
So that is where fascial restriction and fascial release can run the entire gamut. Like you can have somebody that has headaches and you can literally wrap it down to their bunion.
That's
or
correct.
Pain in their plantar fascia, right? The bottom of the foot. It permeates every part of our body.
That's correct. That's correct. So, and that's what I spend a lot of time doing, releasing the fascia wherever the fascia is restricted. And you know, a lot of these people, like all of us, have had injuries, previous injuries from before. So they come in with pre-existing injuries or restrictions in the fascia, in the lymphatic drainage, or in the craniosacral system, which we'll discuss a little bit later. And so, you know, you're dealing superimposed on all those restrictions. Now you have this coronavirus that comes in and wreaks havoc, because it is just wild what it can do and where it can go. It's been found in every part of the body. It's been found in the brain. It's been found in the stomach lining. It's been found, you know, I mean, around the heart. So it really goes everywhere, and it causes so much inflammation and irritation in the body. So this is why I think some of these people who already had some pre-existing limitations in their fascial system and their lymphatic system or their craniosacral system will end up lingering, you know, with these symptoms, because now the body is so taxed by this virus, in addition to all the things that were already there, that it just doesn't know what to do. And you know that, you know, it needs help to get this stuff flowing, to get things moving. And this is why I think that, you know, this treatment is helping. You know, it's making a difference in people's lives. So as we were talking about it, you know, so I'll work on the fascia in the abdomen, and then you know, and throughout the session you're actually testing and feeling, and the body will lead you to where it needs you to go next. So if I'm working on the fascia, let's say on the intestines, in the abdomen, and then I'll feel that it sort of pulls me up around, let's say, the chest. So I'll go up in the chest, I'll work on the rib cage, I'll release the rib cage. You know, there's different techniques for that you learn. And then from there, I'll work on the neck if that's an area that's tight. And then I'll go into the craniosacral system. All the while through, I'm also doing some lymphatic drainage. The lymphatic system is an amazing system. It's such an important system in the body. Without the lymphatic system, we would not be able to live very, very long, because it has three very important functions. One is that it, you know, maintains homeostasis with the fluid in our body, so that whatever fluid sort of seeps out from the circulatory system into tissue. The lymphatic system is the way, you know, about 10% of that fluid that's leaked out needs to be brought back up into the circulatory system. And that's what the lymphatic system does to maintain the homeostasis. And the way it works is usually, you know, it's
homeostasis, by the way, everyone, just means balance. Okay.
Yeah.
It just means things are in balance. So it's not a crazy fancy anatomy term. It just literally means it brings the body back into balance.
Back in balance. Right. So what ends up happening is that, you know, the way that fluid that seeps out from arteries, you know, the capillaries into the tissue, gets brought back by muscle contraction.
Mm-hmm.
Back into because the lymphatic system has this extensive, network of vessels all over.
Mm-hmm.
And besides the vessels, there's lymph nodes and there's ducts and there's organs that are, connected to it. So by doing muscle pumping, we push the fluid back into the lymphatic vessels, and then it progressively goes. There's some valves that prevent, backflow, and it just continues to move forward and forward and forward into larger and larger vessels, into the, and as it goes through the vessels, there's little lymph nodes, the little nodes that, you can feel sometimes around when you have a sore throat or something in your neck. Those lymph nodes are extremely important because the second function of the lymphatic is to help the immune system. It helps to fight off infections. It gets rid of, as the lymph fluid passes through the lymph nodes, it gets, sort of cleared away. And if there's any kind of bacteria or any organism that shouldn't be there, it gets attacked. And the lymphatic system produces these cells, T cells and B cells, that attack these intruders so that we can get rid of them and we can be healthy. Eventually it goes back into the venous system, and it gets excreted through either, whatever is not needed gets excreted through our kidneys, mm-hmm. and out of our bodies. Mm-hmm. So that's the lymphatic system. So what happens if it backs up, if it doesn't work well, if there's a strain on, somewhere in the fascia of the lymphatic system, either in the head, in the neck, or anywhere in the body? What ends up happening is that there's a backup. The fluid can't flow well. And so, you have this fluid that's pooling there. In addition to that, you also have irritants, because you have these toxins that are not getting, you're not getting rid of them. The body's not breaking them down. It's not, excreting them. And so they cause more and more inflammation. Mm-hmm. That's I think one of the problems of people that have the post-COVID symptoms, the long haulers, is that it feels to me like their system, their lymphatic system, is not working well. Mm-hmm. So what one of the things that I do is I work a lot on lymphatic, pumping, on trying to get the lymph to move, especially if there's an area that feels congested. I work, through massage, lymphatic drainage. I work mm-hmm. on releasing that, and the breathing. One of the things that's really, really important that helps with getting lymphatic, the lymph to move better, is to do diaphragmatic breathing, or belly.
And I want to talk about that later, because okay. I have a question on breathing for you and how it affects with COVID patients. But so our friend Jenny is on right now, and this new feature of IG Live allows us to bring somebody on. So I thought I was getting a little crazy here. I want to see if we could bring Jenny on, because Jenny did have COVID. Jenny is our patient. She's allowing us to bring her on today, so this is fine. She agreed to this. So I'm going to see if we could bring her on, because I want to kind of have people see what this kind of post-COVID situation is. Let me just see if I can find her, send a request. And I think we're going to split into a third screen. I'm not quite sure. Jenny, could you see if you can jump on with us? And if you can't, then maybe I just don't have the option to bring you on yet, because I think this new thing just launched yesterday on Instagram.
Oh my God, I'm impressed.
I don't be so impressed too quick, because it might not work. Jenny, are you on? Can you just let us know? I sent you a request to join. Jenny, are you there? You said hi before. No. All right. Well, let's see if she can somehow jump on. She will, if not. But I thought it would be kind of neat to have her on to talk about her experience of having COVID. Oh, try again. Okay, hold on. Hold on. Cancel. Let me see. Jenny. Let's see. I don't know, Jenny. It's saying you're not able to join for some reason. Let's see. Send request again. Maybe it's just not, maybe I'm not allowed to bring anybody on.
Oh, there she is.
There she is. Jenny, can you hear us?
I can hear you. Can you hear me?
Okay, good. Perfect. Okay, so Everybody, this is Jenny. Jenny and I go back, would you say almost 20 years?
1998, yeah.
Yeah, well,
More than.
oh, we can have up to 4 people. Okay, but only 3 right now. So Jenny is also an occupational therapist, and she is a wheelchair specialist. And I mean, she's just another badass in our whole wellness continuum here. Unfortunately, Jenny did wind up with COVID this year. And so Jenny, can you just tell us about your experience having COVID, and then what your kind of post-COVID, you're considered a long hauler, right? Because you're having some symptoms afterwards. Yeah, so just take us through that.
The COVID experience, I almost want to say was a walk in the park compared to this long hauler post-COVID experience. I got sick last year in March and felt like I had a really bad cold. My breathing wasn't great. I had to use an inhaler a little bit more frequently. And then I got better. And I would say I sort of resumed my level of activity. I was exercising again. And then at some point in the summer, I started having these symptoms of dizziness and of fatigue. And I just didn't feel good. And it got worse and worse over time, and not to the point that I can't. I mean, I'm a lucky long hauler in that I am able to get out of bed and go to work and do what I need to do on a daily basis. But it's every single day, I'm more tired than I used to be. I get these crazy waves of dizziness that will come out of nowhere. And sometimes, they'll peter off. Sometimes they'll just come and then they're gone. And yeah, I can say with all certainty that actually having interventions from both of you has really made a difference, because like Candida was saying before, there's clearly a fascial component. I have pre-existing injuries that are definitely playing a role in my difficulty with regulating my autonomic nervous system. And
tell everyone what the autonomic nervous system is.
It's basically you're gonna put me on the spot here. I'm a wheelchair therapist. It's basically what really helps to regulate your heart rate and your breathing and all of your
it's your fight or flight versus your rest and digest system. It allows your body to regulate how you're experiencing stress.
Yeah. And so I think that I have definitely had, I don't regulate stress quite as well as I used to in terms of on the physiological end.
Mm-hmm. Okay. So when you've gotten this kind of treatment, because Candida and I feel like we talk the same language. I just happen to use needles and my hands, and Candida uses her hands. So we're doing the same thing. We're definitely doing fascial release, and we're moving lymph, and we're getting circulation to flow, and we're doing all these great things. Just 2 different sides of the medicine, just using different modalities, really, like hands versus needles. But Jenny, I mean, have you noticed a shift in feeling better more frequently after your treatments?
So I definitely feel better. Well, today I definitely feel better than I did several months ago. It's taken time, and there are 2 different levels of feeling better. I know that after the first time I saw you, I almost felt like there was a detoxifying component to the treatment. I kind of felt like a lot of toxins were released from my system, and I felt it was a little bit easier to breathe, and it was a little bit easier to function. And with Candida, I saw Candida today, and she started in my abdomen and worked on my rib cage, and today I felt great during the day. I didn't feel as great this evening, because I think what happened is I felt great. So I was a little bit more mobile when I was at work, and I paid the price a little bit. But it's definitely helps with the recovery for sure. I mean, I'd say how I feel today compared to how I felt months ago. You know, my smell is pretty much normal now, which it wasn't when I started these therapies. So I know that there's sort of a clearing component that's occurring.
And I think also with the whole smell component, right? I mean, everyone out there, Candida was talking about this craniosacral. She kept using the word craniosacral. Cranial being head, sacral being that kind of lower part of the spine. You know, it's joined by way of your nervous system, your spinal cord, and all of the fluids that go through the spinal cord as well as your nervous system. So when you have this sinus congestion or irritation or inflammation in the sinuses, we have a bone that sits in the back. It's the ethmoid, right? And when that gets irritated or inflamed and your sinus can start pressing on that bone, it looks like a butterfly. If you look at it from, like, if you open the skull, it's quite an extraordinary looking bone. It's very fragile too, and that's where the sinuses all sit. I think what happens is that because you have this chronic inflammatory state that's happening from this kind of post-COVID situation, you've got all of this congestion, which is potentially causing this inability to smell. But then when you start to free up that fascial system and to get things to start to move again, you go back to this homeostasis, which is what Candida was just talking about. Like, there's this balance. So now you're going to start to feel a little bit more normalized. Am I right? Is that kind of how you're feeling?
Yeah.
It's extraordinary. I mean, any kind of body work like that can bring the body back into balance without having to give you a medication with side effects is really what we're looking for. And that's why we love this medicine. It's why we do this medicine. Yeah. All right, Jenny, thank you so much. I didn't want to put you on the spot, but it was just super helpful. And, you know, obviously,
I mean,
love you.
I'm more than willing to talk about it, because the two of you have made such a difference in terms of my quality of life with living with this. So
thank you, Jenny.
You're welcome.
All right. Bye, guys. See you, hon.
Bye.
I don't know how to get you off of here, so you might want to, like, close out. Otherwise, you're going to stick on that third screen.
Bye-bye.
Okay, bye-bye. All right, so Candida. All right, yeah, there we go. Okay, we're back. All right, let's talk about lymph. You did talk about it earlier before. You know, what are some of the ways that you can tell your clients to work on their own lymphatic system? Like, how do you give them tools or tips or tricks that's going to help them to stimulate the lymph system, because we know how important it is? And what you talked about earlier was, for people out there that don't understand, the lymph system does not have a mechanism to move itself. So we need to utilize our muscular pumping system to help get your lymph to move. So, like, for instance, you know, when I treat patients with lower extremity issues and they're not doing ankle pumps, right? They might have swelling in the knee after surgery. How do you get the swelling to move? You can do ankle pumps. How many yogis teach legs up the wall, right? That's an extraordinary posture to put yourself in at the end of the day if you find that you have, you know, lower extremity swelling. Or, you know, if you're wearing really tight underwear all the time or really tight pants, it cuts off where that lymph needs to go from the groin. So you might have lower extremity swelling. So all of these things, these are at least tips and tricks that I tell my patients to do, you know, the legs up the wall and all that stuff. Do you have any other specific techniques or tips that you give your patients?
Yes, and again, it depends on where the swelling is present.
Yep.
But for mostly everybody, because so many of them have cognitive issues, or they're feeling dizzy, or they just, you know, they have a lot of headaches and things like that. So I start them off on releasing the chest, because by opening up the chest, it actually allows drainage from the head and neck. So the way that I have them do it is, and I use breathing, you know, in conjunction with these techniques, because the two go hand in hand. If you can get your breath moving, you're going to get some of the lymph to drain better. Mm-hmm. So I have them start off by putting their hand in this position, one finger, the index finger and the middle finger, on one clavicle. The clavicles are right up here, and then the thumb on the other. So you want to sit with one, you know, one finger on one clavicle, the thumb on the other, and then you take your other hand and you just put it on top of that. And then what I have them do is takes like 5 to 10 deep breaths. And they're going to breathe in to a count of 4, hold to a count of 4, breathe out to a count of 4, and then hold again before they take the next breath to a count of 4, while at the same time they're applying a gentle pressure towards the back. So they're putting pressure on the clavicles, going towards the back, and then down towards the feet. Yeah. And they just hold that. And what that does is it releases the fascia here in the chest. It's called the thoracic outlet area. And by doing the breathing while they're doing that hand position, it actually helps to open up and to help drain stuff from the neck. So that's the first step. This is a little bit, there's like several steps to it. The second step, to open up the sinuses, I have them first open up the temporal bones, which are the two bones on either side of the head, by doing an ear pull.
Yep.
So 2 fingers in the ear, and then they pull down and out on a diagonal. Yeah. And they hold that again for like a few deep breaths, because you really want to give a chance for your system to set and to, open and to release. And so about 4 or 5 deep breaths, or just about 90 seconds, I have them hold that. And then the third thing they're going to do is, I'm going to take my glasses off. They're going to put one hand on the bone here on the bridge of the nose. This is for the sinuses up here, and the other hand on the frontal bone. So they're going to span across their forehead, and with the hand on the nose, on the bridge of the nose, they're going to pull out and down. And with a hand on the forehead, they're going to pull out and up. Mm-hmm. And by holding that, if you hold that for a while and you do some, deep breathing, or you can do some, it's called ocean breathing, where you're breathing through the back of the neck, the back of the throat. What that does is, after 30 seconds, they start to feel like an opening or a draining sometimes. Mm-hmm. And so that's the third part. And then after they release all of these little things, I just have them do some gentle self-massage on the front of the neck. And it's a nice continuous motion, 5 to 6 times, all the way down to the clavicles. And then I'm going to have them do it also to the back of the neck, on the side, rolling and coming down over by the clavicles again, because that's where there's a lot of lymph nodes there. There's going to be, a lot of, it's a good area to sort of send all of the lymph fluid.
I love that, and I love how it feels. I want to add one thing to that, because I think also this is something that I teach to my patients as well. So if everybody out there knows a baby, they have those soft spots, right? They're called sutures, and they obviously close. They stay open when you're born a little bit, so they feel soft. But sometimes the lymph can pool at the suture if the suture has very tight fascia. So this is specific for patients that have headaches or migraines or any sort of like real tightness in the scalp. One really great thing you can do is you can take your fingertips and you can run up right behind where the top of the hairline is, right behind it, and you can literally just massage it back and forth. That's the top of the suture here. And also where you were talking before, the temporal suture. Yeah, really getting in there. And, you can feel for it. And sometimes you can feel that there's like almost like a pocket of liquid.
Yes.
It feels like that underneath the scalp itself. And I'll tell you something, I've had patients that do this that suffer from migraines. And once they could recognize that pocket of fluid, they can dissipate it. And it's like everything gets clear. Their headache goes away, their eyes are clear, their sinuses clear up. It's an extraordinary self-mobility treatment. Okay, I wanted to ask you about, because before we touched on this, and we're running out of time, so I won't take much of your time anymore, but I wanted to talk to you about the emotional component that goes with stuck fascia. Yes. Because from just as a body worker, I've seen many cases of patients that have, like I said earlier, you hold your issues in your tissues. So if you have a trauma, and I think COVID itself has been a pretty emotional trauma for everyone. But for those that have had it, you know, there's got to be some sort of emotional PTSD that goes along with it, right? There's fear there. So what are you seeing emotionally with these patients? And are you seeing are they having any emotional reactions to areas of their body that are constricted? Are you noticing that? Or are they experiencing emotional release on your table?
Yes, absolutely. Yes to all the things that you've asked. First of all, there's definitely a lot of emotions that come with this, you know, and I think one of the bigger ones is just sadness, depression, not being able to do the things you love, not being able to go back to your life. I mean, it's stressful enough, the whole pandemic and the whole not being able to contact and be around your loved ones and friends and all of that, but just then not feeling good and not knowing whether you're ever going to be able to go back to your normal life, to doing the things you used to do. So a lot of them come in very sad, very depressed. There's definitely fear for the future, not knowing, because honestly, they're not getting any answers. You know, nobody really knows, and doctors are really are trying to help support them and to give them as much information as they have, but they don't really have very much right now. So I think that's, not knowing is one of the hardest things to deal with, because you just don't know where it's going to go from here. So there's definitely that. There's a lot of anxiety. There's a lot of, you know, loss, a feeling of like, I've lost so much function. I don't even know who I am. So it brings up, you know, the whole self-esteem issues and things like that. So yes, those are a lot of the emotions that are brought and are felt, you know, by a lot of these people that are going through this. And then when you release, and this has happened not only with, you know, with these patients, the post-COVID patients, but also anybody. Sometimes it really, I mean, like, I'm amazed at just doing a very gentle technique. And I was actually working on somebody's head, you know, doing some cranial release, working on some of the bones to try to open up the space, because, you know, the cranial bones have this beautiful movement. They open, they expand, they rotate, and that's what helps to, you know, to move the cerebral spinal fluid, which is an important fluid that's within, like, the brain, that covers the brain, surrounds the brain, feeds the brain, protects
Keeps it
the
healthy.
brain, spinal cord, keeps it healthy, gets rid of toxins and things like that. So it's such an important fluid. But when it's blocked, you know, then again, you have all of these different problems that we've talked about. So I was working on somebody's head, and they just started to cry, you know, and it was, you know, it was just a release. It was this incredible release where I was working on the central suture, which is right up here. And, you know, she just burst into tears and didn't really understand why, but it was just whatever the emotion. You know, this is one of the things that is talked about in osteopathy, that, you know, when we sustain an injury to the physical body, there's also an emotional component that gets absorbed into that lesion, you know, into that injury. And that emotion stays there. Unless you release it. And when you release it, then you can promote better healing. If that emotion never gets released, then you kind of, you know, it always lingers there, and it's always an issue. So you actually do want these emotional releases to occur, because it makes the treatment, I think, longer lasting. I think you kind of remove some blockages that would remain. The emotion is not let go. So I've seen that.
Reminds me of a patient I had many years ago. She came in with like unrelenting shoulder pain, and was going through her history, and it wasn't anything in particular. She just had shoulder pain, and I started studying this year transgenerational trauma, and you know, how trauma passes on through lineage. And I didn't know this then, but it was this tremendous experience with her. And as I'm releasing the back of her shoulder, I was doing some needles on her. She just started crying, and it wasn't because of pain. I had said, you know, what's going on? Talk to me. Tell me why are you crying? What's the emotional experience? And she said, I had a flashback when my mom was diagnosed with breast cancer, and she died from breast cancer. And it was as if she took this really traumatic experience of her mom and her mom's passing and kind of shoving it into her shoulder. And it wasn't until we kind of made that connection for her that she was able to dissipate and break the dam down, so that she no longer had to carry the cross, the emotional cross, and the experience, the sadness, the grief, you know, that, and the fear that she had. And it was extraordinary. And once she was able to get through that, I mean, her shoulder pain went away. So it really had nothing to do with her structure. It was her emotional trauma that got lodged in her tissue. So I always encourage patients, after they have a trauma or an injury, you got to work on that emotional piece. Otherwise, it's going to get shoved, and it's going to wind up in an organ, or it's going to wind up in a joint, or it's going to wind up in your tissue. And then it's always going to nag you, and you got to set it free.
Yeah,
you got to
exactly.
set it free.
That's so true. During, some of the treatments, especially when I'm working on an area, sometimes when you work on a particular area where there's a lot of there's a very strong emotional component, you actually feel that area vibrating.
Yes. Yes.
Did you notice that? I'm sure.
Oh yeah. And sometimes I wind up getting very hot.
Yes.
I can almost feel this, like, it's like they're emitting so much heat.
That's
that
correct.
It's, and this is before I was perimenopausal and having hot flashes, but this was like in my 30s, and I'm like, whew, what is that? I gotta open the window because it's so hot in here, and they're like just emitting heat and crying and all this emotional stress. But I mean, it's just so extraordinary. Our bodies are, I always tell this to my patients, like, we all have the ability to heal. Our brain is, our mind is what gets in the way so many times. It could be our greatest asset, our biggest problem, and especially when it comes to healing. And one of the things that patients always say to me, like, when will I know? Like, when will I know that I'm better? And I usually say, like, when you no longer have that unconscious fear of moving, or unconscious fear of moving that body part, or experiencing your body as a whole. And I think that's what osteopathy, at least that's what I learned in osteopathy in PT school. That's what it does to the patient. That's what it does to us. Because you can't separate the mind, the body, and the spirit. You just can't.
It's all connected. And if you do, then you end up not doing a full job. Like, you're just focusing, if you're treating a painful knee and you're just constantly just working on that knee alone and not really seeing how everything is connected and what's inside that knee, and what brought that knee pain on for you. So this is, I try to really have a dialogue with patients as I'm treating them to try to get through the layers and try to maybe bring up whatever it is that's in there that is contributing to that chronic problem that they're experiencing. So I do try to communicate with them, and and have them just be conscious, even just bringing their attention to, right now I'm on like your head, and there's a lot of tension in there. What could be possibly in here? And breathe into it, try to go deep into it, try to have a communication with your head and say, what's going on? How can I help you? And sometimes that's a discourse that brings up some things, and sometimes it doesn't, but at least you kind of, guide them into the direction that they need to go to be able to really fully heal.
Yeah. All right, so Candida, just to wrap this up, if somebody is looking for a treatment like this, how would they go about? Do they go to Mount Sinai? Is it an outpatient clinic? Like, what is it? How do they get in?
I work in outpatients. So what they would need to do is they would need to get a doctor's referral first, because we treat with referrals, and then they can contact the we have a number for the outpatient rehab department that they can call, and we if they have the insurance that we accept, and everything gets cleared up with that, because of course insurance is a big deal always. Then they can, schedule appointments. Right now at Sinai, I'm the only person that's doing this. But in January, my sister, who is a physical therapist and who's also an osteopath, who's also studied osteopathy. And there's one other colleague of mine. We've opened up our practice in Manhattan.
Okay.
And all three of us do osteopathic work. And so, if they can't get into the hospital, they have an option if they want to come to see us. And we try to be really reasonable with our fees. We don't accept any insurance, but we really are passionate about this work. And we really want to help people, because it is so disheartening not to have the answers and not to know where you stand and what will happen to you. So, we really feel that this can help. And so if it's something that they're looking for and that they really want to work on, definitely osteopathy is the way to go, or to look for an osteopath or somebody that's doing osteopathic manual therapy in their vicinity, in their neighborhood.
Right.
And then the other thing is acupuncture.
Yeah.
I always tell my patients, sometimes doing osteopathy and acupuncture together just speeds things up a little bit.
Absolutely.
I think it's wonderful. I think it's definitely these two modalities can definitely work hand in hand. So, there is hope. That's the message I really want to get out there, that there is hope. There are things that can be done, and that people are getting better. And I think that, just having that message and having that information alone empowers people, and it gives them the strength to go on and to know that there's things that they can do. So that's really what I want to get out there.
Great, thank you. So everyone, if you are interested in seeing Candida or going into the city of Mount Sinai or her private practice, I'm going to put a link up in this IGTV when it hits the platform. I'll put your website. Do you have a website or a phone number?
For your
private practice? I mean, they could find you at Mount Sinai. How would they find you in your private practice?
You know what? They can do it through email, or they can do it through phone. So I can give you a phone.
Okay. So yeah. Or can they just look up your name, Candida Iodice, New York City practice, or?
I guess it would probably come up.
This is your non-techie moment, Candida.
Yeah, they can definitely look it up. I'm sure that they'll be able to
all right, I'll try to figure it out and then put it in the notes later. But anyway, thank you so much for joining us. I mean, what you're doing is so wonderful, and patients are lucky to see you. And Jenny, thank you so much for coming on. So thank you everyone for stopping by tonight. I just wanted to give you my little slogan: integrate health, embrace wellness, and join the collective. This was actually week 10. Next week, week 11, we have on Cecilia Santiago, Waterman Santiago, and she is going to be talking with us about energy medicine, and she's a Reiki master, which I really don't know that much about, but I certainly know that acupuncture falls under the category also of energy medicine. So I kind of can't wait to talk to her about it, her experience. She also uses essential oils in her practice, which is something that I love. I'm a certified aromatherapist, so it's going to be a good talk. And hopefully, if you don't know anything about Reiki, like myself, and you want to jump on, it's next week, Wednesday night at 8:30 p.m. And thank you so much, Candida. Big hugs to you and your family. Yeah, thank you. Have a wonderful. Thank you. Have a wonderful night. Take care. Bye-bye.
Bye, buddy.